I'm Dr. Ray Fabius, the new Chief Medical Officer for Thomson Reuters. Population health then allows us to start to think about how can we integrate our efforts around public health, around wellness, and by that I mean many of the different components of wellness, including mental wellness, spiritual wellness, as well as physical wellness. And when you start to think about these issues around health and wellness, you start to realize in some sophisticated studies that have been done that it perhaps is actually more cost effective to keep people well than it may even be to manage people who have diseases. And in fact, it's similar to what we're dealing with in the Gulf right now. Had we spent money really working hard to prevent a spill, it would have cost, most people think, a lot less money than it's going to cost us to try to revitalize the Gulf after this oil spill. In healthcare, presently, we often are engaged in the same activity. We wait for somebody's personal oil spill and then try to make them as close to what they were before they incurred this illness as possible. But it may take a very long time, and we may not be able to get them to the full stage of health that they had prior to that illness. If we spend time and more monies around keeping people well, we can really start to generate this concept of a culture of health. What this means to a company like Thomson Reuters may even be a competitive advantage, because the research shows that for every dollar an employer spends on an employee's health, they're spending $2 or $3 on productivity-related issues, such as absenteeism, and even this new big idea concept of presenteeism, where people come to work not feeling well and don't perform at their top capacity. And so increasingly, enlightened employers are realizing that it makes sense to build a culture of health inside their organization, not only because it's a nice thing to do for their employee community, but because it has the potential to provide a competitive advantage. I'd like to reach out to each and every one of the people viewing this video to speak about what each and every one of us can do to build this culture of health. And it starts really with not only exercising yourself, but bringing somebody along to exercise with you. And we don't need to do something terribly strenuous, and I would recommend that you do something that's fun. Take a walk in the park with another family member, or take a swim in a pool with one of your children. In addition, it's really time for us to start to eat right. And of course, the government speaks about the notion of 5 to 9 fruits and vegetables every day. This is not difficult for you to keep track of, but aim for at least 5 different fruits and vegetables every day. Try to fill your diet with those healthy foods and try to make them healthy and fresh.